Good afternoon, everyone. This is Dr. Patmos. It is Sunday, January 4th, and this is kind of an emergency video that I want to get out to all of my friends in the state of Hawaii. So, this is really important. If you look in the text below, you will see I have attached a copy of a flyer that was just sent to me uh, announcing a statewide tour by Dr. Robert Malone and Dr. Ryan Cole and some others to try to persuade the people of Hawaii to resist mandatory childhood vaccinations like measles, mumps, chickenpox, polio, and so forth. And there are a number of factually incorrect statements in this flyer that need to be clarified. And I think the Hawaiians need to know the truth about who these people are and what their agenda is. So the first thing to point out is that this tour is going to go through all the major Hawaiian islands over the next week, starting tomorrow. And the point of it is to try to encourage people to reject vaccination for children under the premise that it should be a matter of parental choice, that having mandates for vaccination is somehow ethically reprehensible. And as Dr. Malone says, where there is risk, there must be choice. Here's why that argument fails. If you look at and you understand bioethics, the principle of autonomy is very important, but no principle in bioethics outweighs all the others. They have to be kept in balance. There's also a principle in bioethics of non maleficence and beneficence. It's also wrong to harm other people. And when non maleficence and beneficence outweigh autonomy, then it is ethically very permissible to mandate certain things. This is why we mandate seatbelts. This is why we mandate that you can't kill people. This is why if you have active tuberculosis and you're walking around spreading the disease, the State Department of Health has the authority to either quarantine you or give you treatment if you refuse treatment. So this notion that it's ethically impermissible to mandate childhood vaccinations does not stand on the principles of bioethics. If you want more information on that, I suggest you look up Dr. Art Kaplan, Kaplan. He's the foremost authority in the United States on bioethics, and he's written extensively about this very issue. For childhood vaccination to work, you have to have 95% of the population vaccinated. If we could get that voluntarily, it would be wonderful. We wouldn't need to have mandatory laws. But the problem is that you have people like these anti vax groups, like Dr. Malone and others, who are spreading incorrect information about potential risks of vaccines that don't exist so they can scare people into depressing vaccination. And that drops the rate down below 95%, which then makes outbreaks likely. This is exactly what's happening in the United States right now. Vaccination rates all across the country are plummeting, mostly in Republican-controlled areas, and as a result, measles is resurgent. We have over 2,000 cases of measles last year in the United States with deaths. Pertussis is resurgent. We've had over 200 children die of pertussis. Polio has come back. All of these childhood diseases are returning because of the work of these anti vax groups. And now they want to come to Hawaii and convince Hawaiians not to vaccinate their keiki, and that will result inevitably in a resurgence of these childhood diseases. We saw this happen in Samoa. If you remember, not that long ago, a couple decades ago, Robert Kennedy went to Samoa and convinced everybody there that vaccination was a bad thing, and they had a resurgence of measles, and children died, and it was a real disaster. So they're trying to do the same thing. So what else is wrong in this information in this flyer below? Who are the people who are doing this? Well, first of all, there's Dr. Robert Malone, who falsely claims to be the inventor of the mRNA vaccine. It says it right on the poster. Let me be clear. He did not invent the mRNA vaccine. The record is clear, and I'll attach a link. He was a medical student working in the lab of a professor who had previously published research showing that the lipofectin, this fat substance, could be used to transfect DNA into cells. It was Dr. Feldner who suggested in 1987 that you could also take lipofectin to transfect RNA and even oligonucleotides. He wrote that in 1987. Dr. Malone was a student working in Dr. Feldner's lab doing the research that Dr. Feldner had described that did demonstrate that you can transfect RNA. And his name went on the paper, and now he claims it was his idea. No, the record is clear. He was a student at the time. He was only in his 20s. I guess he figures that nobody's still alive from that era who could figure out that he was just a student, but he was only a student. He did not invent the technology at all. That's a complete myth. Now Dr. Malone has been very famous and worldwide and very powerful. He's now on the CDC ACIP committee. He's making a fortune going all over the world, doing everything he can to discourage vaccination, whether it's COVID mRNA vaccination or other vaccination. He just rammed through policy at CDC that removed the universal recommendation for hepatitis B vaccination at childhood, one of the most important public health measures that have ever been undertaken. We used to have 20,000 cases of neonatal hepatitis B annually. That's now down to 80 cases because of this vaccination universal vaccination at childbirth. And Malone basically pulled the rug out from under that. He's an anti-vaxxer. He's in cahoots with Robert Kennedy and the anti-vax groups, and he wants to come to Hawaii and convince Hawaiians to be anti-vax and not to vaccinate your children. Also in this group, there's a comedian and a singer and a filmmaker who makes bad documentaries like Plandemic, which tried to allege that COVID was all just a plan. I think somebody here is hearing voices, I think. The other person on this panel that you need to know about that's coming around to speak to you in Hawaii, my colleagues, my fellows, my friends, my ohana in Hawaii, is Dr. Ryan Cole. Now, Dr. Ryan Cole is not an infectious disease doctor. Dr. Malone doesn't. He's just a general practitioner. He has 1 year of pathology internship. He has no postgraduate medical education besides 1 year of pathology internship. He has no residency, no fellowship. He's not board certified, not board eligible, doesn't have medical staff privileges at a hospital, doesn't qualify for any medical staff privileges at any hospital, and has no clinical experience at all. He doesn't treat patients at all. He does have a license to practice medicine, though. How escapes me. Dr. Cole is board certified in dermatopathology. He's a pathologist. His training is to look at slides of skin cancer. He has no training in infectious diseases at all, none whatsoever. He's not an infectious disease doctor. He's not a microbiologist. He's not an immunologist. He's not a cancer expert. He's a dermatopathology expert. He has no qualifications to be speaking on this topic. And Dr. Cole has the dubious distinction of having been reprimanded sternly and disciplined by the Washington Board of Medicine, the details below, and also entered into an agreement with the Board of Medicine in Idaho to restrict his practice to what he's trained in, dermatopathology. He's not allowed to practice primary care. So he's been a very heavily reprimanded, disciplined, and sanctioned doctor. So you've got a doctor who claims he invented the vaccine when he didn't, who isn't even board certified, never did anything but an internship in terms of postgraduate medical education, and another doctor who's been severely disciplined, who are coming to Hawaii to convince everybody there to not vaccinate your children. If that were to happen, if the vaccine rates were to decline below 95%, and there's no mandate for vaccinations, school vaccinations, then what will happen is we will see in Hawaii, I am from Wailuku, you will see in Hawaii resurgence of measles, mumps, pertussis, polio, chickenpox, German measles, All of these diseases will come back. These are not benign childhood diseases. They all have significant risk, including risk of death and permanent injury. And all of that is preventable. These vaccines have been proven safe for half a century. And so people of Hawaii need to be smarter than this crowd, this group that's coming to convince you. This Captain Cook 2.0 is coming to convince you to do something that will actually harm Hawaiians. Now, who are they objecting? Who's trying to sponsor this legislation? It's the governor, Dr. Josh Green, who is a doctor, a real doctor. Dr. Josh Green is board certified in emergency medicine, or sorry, board certified in family medicine, and has a long history of practicing as an emergency. He's a real doctor. He's not like Dr. Malone, who's never seen a patient. He's a real doctor, and he has experience managing and dealing with epidemics, having worked in Africa when the Ebola outbreak occurred there. So he knows these diseases up front. Dr. Malone and Dr. Cole have never done anything like that. Hawaii managed the first wave COVID pandemic better than any other state in the nation because we had high rates of vaccination early on. We had fewer deaths per capita, I think the lowest of all the 50 states. The worst states like Florida, their rate of per capita death from COVID was 400% higher than Hawaii. The reason why Hawaii did so good in the beginning with COVID was because of Dr. Josh Green and because of our policy of vaccinating people. I was a medical director at Maui Memorial Hospital at that time, and we had a great program led by Mike Rembus to vaccinate everybody on Maui, and we vaccinated a lot of people. And as a result, the death toll on Maui was tiny compared to the tens of thousands of people who died, for example, in Florida. So that is my message for today. Look, Hawaii understands this. We know what happens when people come from the mainland or they come from Europe with wisdom for Hawaii. You get Captain Cook, you get syphilis and gonorrhea and tuberculosis and leprosy. Hawaiians remember Molokai and what went on there. Let's not make the same mistake twice. Vaccination, childhood vaccination, is one of the most effective public health measures in human history. And we have made these diseases essentially non-existent in the United States until just the last year or two, when they're coming back with a vengeance because of these anti-vax people like Dr. Malone and Dr. Cole. Don't be foolish. Don't fall for this a second time. This is Captain Cook version 2.0. Hawaii, you're smarter than this. You're better than this. Reject these people from the mainland. I won't use the word. You know what I'm referring to. Oh, anyhow, my name is Dr. Patmos. I'm an internal medicine physician with added training in infection control and hospital epidemiology, and proud grandson of Alfredo Tavares, who was on Maui 100 years ago. Aloha.